Epilepsy is as old as mankind. The disease affects over 50 million people worldwide. Despite epilepsy being one of the oldest conditions of the human race, attitudes of past societies towards the disease have left a legacy of stigma and damaging misconceptions which still continue today. Kenneth Banda is a primary school class teacher in Kafue who was diagnosed with epilepsy when he was a child. He had his first seizure when he was with friends. Kenneth says stigma has affected his life in many ways.
Most of my friends, some of them don't even associate with me because of the same condition. And it has disturbed me in some other ways. When I was at secondary school, it was even difficult for me to write even my grade 12 exams. I had to go back because I had some other attacks even the time when I was writing my grade 12 exams. So even as my results came out, they were not as they were supposed to be. As I expected my results, they were not that good. So I had to rewrite the exams. There was another time when I had an opportunity to go out of the country. I was supposed to go to America, but due to the same illness, things were just shunned just like that.
Epilepsy can get into the way of life, especially when seizures keep happening. But the seizures can be controlled. The World Health Organization projects that many people living with epilepsy could become seizure-free with appropriate use of anti-seizure medicines. Kenneth is 36 years old. Over the years, he has learned how to manage the condition.
The time I was young, I couldn't even know that I've had an attack or anything. But as in this time, the time when I've grown up, I can even feel, I have the aura whereby I'll feel that I'm going to have an attack now. So I'll move from one place to another, maybe go home and sit, wait for the attack to come. But some of the times I just tell my parents I'm not feeling well, then they'll take me to the clinic, and after that I'll be helped there.
Seizures are the main symptom of epilepsy. However, experts say symptoms differ from one person to another.
Under focal seizures, if someone has got complex partial seizures, these are patients who would end up having that paroxysmal discharge, electrical discharge, that has started to maybe on one side of the brain, and at that particular point, someone who gets into a fugue state. They won't know whatever is going on, like they're absent-minded for a few seconds to a minute. Then they get into a point where their consciousness is impaired. Then as that electrical abnormality is going on one side of the brain, the body responds by one side with some jerks that are visibly seen by us caregivers.
According to the World Health Organization, epilepsy is defined as having 2 or more unprovoked seizures. But what causes it?
There are various reasons as to why epilepsy happens, depending on the age. So I'll start from the neonate, which is a newborn baby. A newborn baby can have seizures, which when they are repeated, we call that epilepsy, due to things like oxygen, not having enough oxygen when they are born, or if they don't feed enough and then the sugar drops in their body, or if they have a dangerous infection like meningitis. When we talk about a child between 1 month to 1 year, malaria, meningitis, infections to the brain, or sometimes genetic factors also can lead to a baby having epilepsy. But also what we call traumatic brain injury, which is a child hitting the head, or unfortunately they fall into a car accident and they have something that hits their head, and then they develop epilepsy. In the adult population, commonly a cause of epilepsy can be toxins, ingestions of toxins, alcohol withdrawal, other problems, sometimes even diseases of the liver can cause some brain injury that may lead to epilepsy.
Although anyone can develop epilepsy at any age, experts say some people are at a higher risk.
People who have got either a genetic predisposition to having epilepsy, or people who have had an injury to the brain be it now or somewhere in the past, may have epilepsy. They are at high risk of having epilepsy. People who have suffered a stroke in the past may have epilepsy, or other underlying condition that predisposes injury to the brain may end up with epilepsy in the future.
Epilepsy is a chronic non-communicable disease of the brain that affects all age groups. But how common is epilepsy?
There are many people living with epilepsy in Zambia, but the definite number has not been really looked into. Yes, we have figures at Ministry of Health but it is the people that just visit the hospitals. And you know that with this condition, there are many people that are keeping people living with epilepsy in their homes. They do not want to be known that they have epilepsy, and they seek only traditional healers' attention, not the hospital. So I think this is a wake-up call that we also be interested in research to look at the issues regarding data and knowing how many people are living with epilepsy.
I can't give you concrete statistics, but it's quite common, more especially in the pediatric population, because the pediatric population is at risk of having epilepsy because they suffer from conditions like cerebral malaria and other childhood conditions that cause brain injury, and then they end up having epilepsy.
I can't particularly determine how common it is, but in terms of, if we look at the information we have, the incidence, that is how many new cases we get every year, it's estimated about 82 per 100,000, which is quite a lot of people for Africa. But if we look globally, it's estimated that we have about 50 million cases of epilepsy, and every year about another 5 million new cases occur, which is about 0.5% of the global burden of disease. So if we look at what we have in sub-Saharan Africa and what is happening in Zambia, Zambia falls in between, because if we go to the prevalence, because we've looked at the incidence, the new cases, but if we look at all those cases that are existing all the time, which is the prevalence, sub-Saharan Africa is estimated it's between 7 and 15 per 1,000 population, while for Zambia it's estimated to be about 13 per 1,000 population.
People with epilepsy can face many challenges that include exclusion from accessing education and other public facilities as a result of misconceptions or failure to manage the condition. Alines Daka is 26 years old and was diagnosed with epilepsy at 6.
I just feel very bad. I don't know how I can explain it, but I just feel myself very bad when I'm cooking, I stop cooking and I go and sleep, or I just sit at the chair so that I can't have a problem.
She's sad about quitting school in grade 9.
I want to go back to school, and I feel very much bad because I don't go to school. We are 6 in the family, and we are 3 of us. We have the same problem, but these 2, although they have the same problem of epilepsy, but they are going to school. Now me, they are saying that I can't do anything. Now I always ask myself why my parents are doing this to me. I can be very, very happy to go back to school, because school is very, very important. Whatever job, whatever work, the work that I want to work, they need papers for grade 12 certificates.
This is Charlie Lansomokela of Kakubo village in Chongwe district. She lives about 10 kilometers away from Chongwe town. Her son was diagnosed with epilepsy at the age of 10. He's now 16 years old.
When the problem started, I was so devastated that by that time I was in grade 6. I was worried to say if he was going to make it to go to grade to make it at grade 7 to go to grade 8. Fortunately, he did very well. Managed to go to grade 8 with good marks. Then grade 9, we also again struggled to help him. He did well to go to grade 10. This time he's in grade 11. So this time, it's like maybe the attacks he has been having and the medication he's taking, I don't know, maybe with his age and his weight. He's someone who was a very high IQ. He's very good. But this time the performance is going downwards. When I try to find out from him, he says, sometimes when I go to school I sleep because of the medication that I take. Because this time he's taking the medication 3 times a day. But I'm trying by all means to help him do well.
Caring for someone with a lifelong condition can be stressful and exhausting. Mrs. Nsomokela recounts her experience with caregiving.
It has been so hard, especially this time when he has grown up. And usually the attacks happens at night. So each time he has an attack, it's a must. I need to wake up in order to see that he's lying in the right position. There's no any other thing that can harm him. To tell you the truth, this time, I don't know, it's like I've just been conditioned. I don't sleep before 24 hours.
Mrs. Nsomokela is a teacher by profession and says parents with children living with epilepsy should never keep them out of school.
There are people with epilepsy who have excelled in life. They are able to do work which other people without epilepsy can do. So they should never keep their children at home. They should take them to school and encourage them to work hard.
The Epilepsy Association of Zambia and International Bureau for Epilepsy Africa region have been advocating for quality healthcare for people living with epilepsy. The Bureau feels more should be done to improve services for people living with epilepsy.
Sometimes there's lack of medication, there's lack of adequate or well-trained staff to care for people living with epilepsy. And also we have people not demanding the services. So a lot of things that happen that would even lead to stigma and discrimination and also loss of productivity in one's life. And those are the areas that I've seen that need improvement. We need to do more to advocate on epilepsy, to make people understand, have knowledge about it, because knowledge is a key to improving many of the challenges that are faced.
Dr. Kefas Piri has been seeing patients with epilepsy since 2009. He first started as a clinical officer and has had a passion for epilepsy and other neurological disorders. Dr. Piri talks about challenges in managing patients with epilepsy.
One of the first challenges that we have had is admitting patients living with epilepsy, which is a medical condition, in our psychiatric units. And this has been a burden, and it gives a challenge to both us health caregivers and also the patients. Because imagine if a patient who is diagnosed with a tonic-clonic seizure, a generalized type of seizure, and is being managed on a drug that would put a patient on and they are stable, on a long term, we do still need to see these patients coming for follow-up reviews. And as they are coming to such a facility, all the time we are seeing these patients from mental health facilities, which is giving them a stigma, thinking they are mental patients, when it's a general medical condition.
In May this year, the World Health Assembly, the decision-making body of the World Health Organization, adopted the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders. The 10-year plan seeks to improve access to care and treatment for people living with neurological disorders while preventing new cases and promoting brain health and development across the life course.
Specifically for WHO Country Office, we provide guidance to the government and the people in areas of leadership and governance, so that you make sure that we have the right policies on general health, but also policies on mental health, in particular where epilepsy is one of those, and also guidance on non-communicable diseases. So you provide the leadership on that. When you have that leadership and governance for that, then you make sure that you have those plans that will make sure that we have finances to address the problem, the required human resources to manage the various aspects, whether it is to manage the patient or even the socio-economic consequences. So you need to build the human resources, but most importantly also to make sure that the medicines are available. So in order for that to happen, therefore, you make sure that you have national health care plans that include epilepsy, because epilepsy is a disease of inequality and inequity because of the stigma and discrimination associated with that. So if you don't include it in the national health care plans, it may not be taken care of.
With the adoption of the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, the International Bureau for Epilepsy Africa region is keen to work with other organizations that deal with neurological disorders.
We are interested because we are affected, and we know that there are many people that will benefit from it. Not only people living with epilepsy, but this time is neurological disorders. And we're working with the Minister of Health to see how we can partner with other organizations that deal with neurological disorders, and also coming up with a task force that will look into these areas. We started this task force formulation way back when we did our phase 1 project, and therefore we're just looking at the Ministry of Health to strengthen that idea that we have to have a task force to work around this and follow the measures that are being adopted by WHO.
Dr. Nathan Bachaita is the representative at the World Health Organization in Zambia and says it is essential that the country works towards integrating epilepsy care into primary health care.
We need to work towards making sure that we integrate epilepsy care in primary health care as part of the universal health care approach. Yes, there are some aspects of epilepsy that may require specialist care, but there are models in a number of countries like Ghana, Mozambique, in our own setting, where they have been able to integrate care for people with epilepsy into primary health care by training the health workers, making sure they can make the diagnosis, making sure that the affordable, effective medicines are available, and that has worked very well. So making sure that we work with government on that will be important. Of course, making sure there is access to medicines. There are about 11 known medicines for epilepsy, and many of them are very effective and are affordable. So just making sure that they are on the essential medicines list and also are available in the stores and distributed at the facilities where they needed.
Epilepsy is a major public health concern, and the World Health Organization recognizes this.
In terms of diagnosis, it's very, very important for us to teach the primary health workers, especially at that level, to be able to identify this is epilepsy in terms of what is the definition, what is the working definition, and when they do that, if it's at a higher level, to know some of the equipment that could be used. For example, there is the EEG, which looks at the waves in the brain that can give you a definitive diagnosis. Sometimes it could be that you have metabolic dysfunctions that have caused this. So in terms of diagnosis, the guidance is there, what is recommended at various levels, and how you can use that to improve the patient outcomes. Now, rehabilitation is extremely important, and part of it could be within the health system, but some of it goes to the social services. So this is where we have to work, for example, with the Ministry of Education, because a lot of these people, because when you look at the spectrum of epilepsy, it tends to peak in the very young and also those above 60. So a number of the people who will be managing are likely to be in the education sector, so working with them, Ministry of Community Development. You also need to work with the Ministry of Labor to make sure that just because somebody is epileptic, they're not discriminated against in terms of employment opportunities. We also have to work with the civil rights and justice and so on to make sure that people's rights are paid attention to.
In this part of the world, it is common practice for families to first look for help from traditional healers and seek medical attention only when seizures worsen. Kenneth went through this.
I had an attack. Then Dad decided to take me to a certain lady. They were these are traditional doctors. We tried that first. Upon trying that, we went here and there. That lady gave me some medicine, they put tattoos on me, but after some time, the same problem came when I was in grade 8. It continued. So upon doing that, I waited. Upon writing my grade 8 exams, I remember, grade 9 exams, just upon writing my grade 9 exams, my dad took me to Chainama together with Mom. Yes, they took me to Chainama Hospital. That's when they went and did some tests. I remember it was, is it ECG or EEG? Yeah, they did all those same tests. And after that, they had put me on medication.
In Africa, traditional healers play a major role in the treatment of patients living with epilepsy, and their understanding and beliefs have a considerable influence on the treatments that are administered. And in Zambia, the Traditional Health Practitioners Association of Zambia is working with government and the Epilepsy Association of Zambia in various areas.
We work with government in the provision of, one, in the area of providing medicines for scientific research. We work with government so that we can find a remedy for epilepsy. We've been engaged in meetings with the Epilepsy Association of Zambia, and we've attended their meetings, and they've also attended our meetings under the umbrella of CCM, which is the country coordinating mechanism of Zambia under NAC. So all in all, it's that